There I am.
So just for everyone watching right now, we've got Zoom and then we've got Instagram Live. So give us some feedback. Make sure you guys can hear us. I'm just going to turn the live down a little bit, just so you're not getting any feedback, or my peeps on Zoom aren't getting any feedback. So thumbs up, we're good. And welcome, Dayna. It's good to see you again. I know it's going to be weird looking back and forth, but that's okay. I feel like it's going to be okay. Before we get started, I'm just going to introduce you a little bit. So we've known each other for a long time. I've seen you exercise and basically remain active through both of your pregnancies because you're a mom of two.
I am.
And then as well, you are a pelvic floor physiotherapist. So you were a physio and then you got into pelvic floor health. So why don't you tell us about that transition a little bit, and what sparked your interest into pelvic floor physiotherapy?
Yeah, for sure. Let me just turn this down. Alrighty, is that better?
Yeah.
Okay.
Is everyone good? Are we getting any like dual feedback on the Instagram Live? Are you guys hearing like double or Zoom? Or are you guys okay? Thumbs up if you're okay. Give us some love. Give us some hearts if you're hearing us okay.
Just having to.
Oh yeah, I think it's good. Okay. So how did you get started, and what sparked your interest to become a pelvic floor physiotherapist?
Yeah, for sure. So I graduated 10 and a bit years ago as an orthopedic physio, came out really excited to practice in orthopedics. I was always active in athletics growing up, and for sure thought that is where I would spend my career. I knew about women's health physio, pelvic physio. There was, some exposure to it in school. And then of course it was the odd therapist that I came across in the early days of my career. And I was just like, I'm so glad people do that. It's just not for me. And I think it was just stage of life. I didn't really fully understand the breadth of issues that could come up for people, anybody with a pelvis, humans, but particularly women. And then when I started to get a little bit closer to the age of having babies myself, and my friends were starting to have babies, they would say things to me like, start doing your Kegels now, and you're gonna just pee yourself all the time after when you play soccer. And I started thinking like, these are active women. These are strong friends that I have. That doesn't seem right. There's got to be something more to this. And so I started to look a little bit more into pelvic health physio, and I took my first course almost 5 years ago now. And my mind was blown. I had no idea the breadth of issues. It is so much more than just incontinence following pregnancy or having a baby. Of course, that is a big concern and thing that I see in the postpartum population, but my mind was blown. It was urinary incontinence, pelvic organ prolapse, digestive issues, endometriosis, painful intercourse, all of these painful pelvic pain syndromes. I had no idea. My mind was blown. And from there, I just became super passionate about it. I ended up finding out I was pregnant the month after I took my first course. And so, of course, then I was personally invested and just have been so passionate about my learning since then, and just trying to spread the word on, no, you don't have to deal with these things just because you had a baby or because you're a woman. There is a lot you can do to help, and that's what pelvic physio is here for.
Yeah, and it's so interesting too that you bring up these points, because even for me, with my knowledge around pelvic floor health, rehab, and pelvic floor physio, like it's kind of, for me, it's been an emerging subject that I just first learned about 5 years ago, when Jackie actually started working at Rebirth, or no, Angela, it was Angela. And it was crazy to me that I had worked in prenatal postpartum fitness for 5 years. I did an undergrad in kinesiology. I was working with athletes all the time who experience incontinence issues, but no one talks about it. But yet it was such an understudied field in research, in women's health, in education in general. Like there's nothing about pelvic floor health and rehab in the curriculum at Western for undergrads. And so, we're trying to change that. And I think the best way to do that is what we're doing here right now, is just having these conversations around it. So for the people who have never heard of pelvic floor physiotherapy, pelvic floor health. Do you have your little anatomical model you can explain to everyone who's watching, who's maybe like, what the heck are you guys talking about? Can you like tell us what the pelvic floor is, what it does, and some issues that might arise with it, just for the average everyday person, and then we'll get into more specifics around prenatal and postpartum.
Yeah, for sure. So this is probably my favorite piece of equipment in pelvic floor physio. If you have been, there is a lot of education. Most of us, well, we have our pelvic floors our entire life, and we generally don't think about them. Like you said, I love how you mentioned athletes are leaking and not talking about it. That's huge, and more research to be done, more to come on that for sure. But we don't actually know where the pelvic floor is, where does it sit, what is it doing? So the bony pelvis, just to orient anybody who is not anatomy based, which is totally fine, these big bones are where you would place your hands on your hips if you were standing.
Mm-hmm.
So along the front of your bony pelvis, you have your abdominals that attach into the front, the back, you've got your back muscles that come down. Your glutes or your bum muscles are attaching across this big bone here. Your femur, your leg bone sticks in here. So you've got your quads and your hamstrings, your adductors or groin muscles all along here. Massive bony movers attach externally. So the one thing I like to say about pelvic physio is, yes, we do address the pelvic floor, but really I like to think of us as holistic. We're looking at that whole body and what is happening externally in other areas of the body that affect what's going on in the pelvic floor. All of those big movers attach directly in here and can affect what's happening.
Yeah.
Then when we look down in the middle, the rectum for some reason is not staying put, but we've got our bladder, our uterus, and our rectum. So those are our pelvic organs that sit in the bony pelvis. Mm-hmm. And then when you remove those, this bowl of muscles that lines this inner bowl, so it goes up the front back sides, is your pelvic floor. When we think about the pelvic floor, the movement of it, those muscles, when they come up or lift, that would be a Kegel. Most women are people are most comfortable with what that means. And they also need to relax and soften. Not many of us are familiar with the idea of that. These muscles all day hold up these pelvic organs like a stage. They're holding them up. They are staying contracted. The outer layer, there are different layers of the pelvic floor. The outer layer has our sphincters, so the urethra, vagina, and rectum. So they're hopefully staying contracted when we want them to, holding in our urine and stool, and then relaxing when we want to void our bowel and bladder. They have a circulatory function between the lower body and the torso, and they have a sexual function. During pregnancy, they have an extra load on them. They are holding up this growing uterus, a growing baby. And then for birth, the pelvic floor muscles don't push the baby out. Your fundus, or the top of your uterus, does, but your pelvic floor muscles have to soften and relax in order to let baby out for a vaginal delivery. So the most common issues following pregnancy, birth, are urinary incontinence. That's the big one. But pelvic pain, so any sort of pelvic pain, pain with intercourse, or just pain in the vulva or the exterior portion of the pelvic floor, is very, very common. Pelvic organ prolapse, which is a lowering of these pelvic organs. And women, rightfully so, freak out about it because the messaging, and if you Google it, good grief, don't Google it. It's horrifying. It's fear-based. And what we need to educate women is that these things absolutely are normal. It's so, so common for them to happen, but you don't have to deal with it. There's so much we can do and give you a better quality of life.
Yeah. And what I always try to educate people on, and I love that you talked about treating people holistically, because I've worked with athletes. I have friends in the gym even who are like, I've got nagging back pain. And they're like, I've gone to a physio, I've gone to chiro, I've gone to massage, and nothing seems to be working. And I'm like, well, have you gone to a pelvic floor physio? And they're like, well, what is that? And I'm like, well, they're going to assess your pelvic floor, because I like to attribute it like a wicker basket, like, your Easter egg basket. It's all these muscles, as you so clearly demonstrated, that interweave to support everything in your torso. Like, it is supporting the entire contents of your torso, similar to our feet, support our body. But most people aren't aware of those muscles. And I like to say, because we don't see them. Right? They're not muscles that we generally, it's not like your bicep where you're like pumping and you're like, yeah, it's contracting, it's working. Most people don't even know if they're contracting their pelvic floor, if they're contracting it properly, and then to your note, how to relax it. So I think you refer to those terms as hyper or hypotonic, right? So give me, especially for, let's talk about pregnant and postpartum women, why might it be beneficial during pregnancy to go see a pelvic floor physio in regards to understanding whether or not you're hyper or hypotonic, and how that might affect your labor and delivery?
Yeah. Awesome question. So I see all ranges of pregnant women. I have the women who are super uncomfortable and, sometimes have incontinence. Maybe they've got pelvic pain or pubic symphysis pain. Lightning crotch is the not so cute name for some of the shooting pain that can happen in and around the pelvic floor. Pain with intercourse, feelings of heaviness in their vagina, all the way to I'm having a dream pregnancy. I don't have any pain. I feel fantastic. And I think it's really important to recognize that either of those extremes and anybody in between could benefit from a pelvic floor exam or assessment during pregnancy. The pelvic floor, usually around 18 to 20 weeks, I don't have any specific research about that. That's just my clinical experience, will start to naturally increase in its tone. It's doing more. So if you're coming back to your bicep analogy, if you're carrying textbooks, over time, you keep adding textbooks on, the load is increasing. So there's increased tension and tone in your bicep to hold that load. The pelvic floor is no different. The pelvic floor muscles do not function in a different special way. We just can't see them. And often we're not as in tune with them because we can't see them. So what will happen naturally is around that halfway point, as baby really starts to increase, we have this increase in tension. Like I said, most women are not familiar. When I tell them they need to relax their pelvic floor, they look at me like I have three heads. Everybody thinks or is told, even, I can remember reading Cosmo in my teens, and I do your Kegels. Everybody thinks they need to contract.
So guilty.
Yeah. Everybody wants a strong pelvic floor, and strength really is that full contraction, full relaxation. A truly strong muscle is able to fully contract and fully relax. So that I do a lot of coaching of inhale, relax. Coming back to what I was saying about one of the functions of the pelvic floor during birth is to soften and let go, to allow baby to pass through the vagina. So we want to make sure that we are able to soften those muscles, preparing them for birth. So I do a lot of teaching them how to use their breath and what are they feeling for, if they're comfortable touching their own, vulva, or inserting a finger gently to see if they're relaxing, or what can they do in their body. There's some interesting research coming out to suggest that jaw tension is directly related to pelvic floor tension, especially kind of in that labor delivery portion. So just teaching them, like, start with maybe inhale, relax your jaw, inhale, relax your shoulders. For the women who are having any sort of symptoms or issues, pain, incontinence, these things, there is a lot we can do during pregnancy. And again, a lot of the same kind of stuff. Can we tune in with that pelvic floor? It's a little bit harder with a growing bean sitting on top of it. But can we tune into that pelvic floor? Can you relax it? Can you lift it? Are there positions or ways we can get you in and out of bed a little bit more comfortably? Maybe we need to protect that diastasis or that ab separation a little bit more so that we're helping out the pelvic floor. The abdominals and the pelvic floor are besties. We want to make sure that they're working together, even though they're getting this larger and larger strain on them. So pelvic floor physio can help across any extreme of what you're experiencing in pregnancy.
Yeah, and you just mentioned diastasis recti. So let's define that for everyone who might not know what that is, because that is kind of the buzzword when you think about postpartum, like, oh, I have diastasis, or, this person has that, or you see it a lot. So what is it? Is it treatable? Is it preventable? How do people get it? What can we do if we have it? And how do we know if we have it?
How do we know we have it? Yeah. So if you're pregnant, you have it. Um,
Yeah.
that's the short and easy answer. Again, this is another one where there's just so much fear about it, so much fearful language. It's absolutely normal during pregnancy. So essentially what it is the two sides of your rectus abdominis, or your superficial abdominals, there's two halves of them. They join with a tendon down the middle called the linea alba. What happens during pregnancy is it stretches. Everything stretches during pregnancy, right? So do your abdominals. So they separate in order to allow space for baby to grow. What we want to see postpartum is that those two sides start to come back together, and not necessarily right back together. So again, a little bit of a light bulb moment for some women when they come to me, they're a year and a half postpartum, they're like, but I can still get my fingers in there. Sometimes you will. There are many, many factors that depend on that. What we want to see is either right back together, or wherever you land, that tendon in the middle is nice and firm. You've got lots of good tension in there. If you're still really squishy there, or when we do, a crunch or a head lift and you get the doming up through that linea alba, or through those two sides of the abdominals, that's when we start to think, what can we do here to maybe rehab this a little bit more? So it's absolutely normal. You can't prevent it necessarily. You can prevent excessive strain through it during pregnancy. So I always have my pregnant mamas roll to their side to get in and out of bed. They usually do this naturally. You get to that point where you cannot do a sit-up anymore, but instead of throwing your body up out of bed, roll to your side and push yourself up, trying to get them in the habit of exhaling when they lift something during pregnancy. Our diaphragm and our pelvic floor sit on top of one another. When we exhale, we actually pull our pelvic floor up as well. When we do that, when we're mindfully exhaling, not only are we getting that protective lift in our pelvic floor, remembering what I said earlier, our abdominals and our pelvic floor like to contract together. So you're developing a little bit of tension through your abdominals, but you're avoiding breath holding. So when you breath hold, you increase the intra-abdominal pressure. And if you do have a sensitive area, you're likely to dome out. So working a lot on their lifting techniques, things like that, to reduce any strain through the linea alba during pregnancy. Those are the things we work on during, and then after, we want to just bring those two pieces, the pelvic floor and, two pieces, the entire core, certainly the pelvic floor and the abdominals, back online. Couple them back together. We use the breath a lot. I've been talking a lot about the breath. The core, we really only think about it usually as the abdominals, but your core is a can. It's your abdominals in the front, all the way around to your back muscles, diaphragm on the top, pelvic floor in the bottom. So in order to rehab your core, we need to think about all four of those. So when it comes to retraining that diastasis, we're going to be looking at all of those. Can we get you breathing a little bit better? Can we get your pelvic floor activated a little bit more? Even the big external muscles, coming back to these guys, are your obliques really tight so that your abdominals aren't firing right? We're looking at it all. So again, thinking about the woman as a whole person, as opposed to just her pelvic floor.
Yeah, definitely. And to your point with that, I love the analogy of the core canister, because I use that all the time in my lectures when I'm trying to educate people on the function of the diaphragm and transverse abdominis and the pelvic floor musculature and the back muscles, right? Our back extensors. A lot of people forget that the whole purpose of transverse abdominis and those deep core muscles are to aid in supporting the spine. And pregnant women, if anyone's been pregnant, they know this. If anyone's seen a pregnant woman progress through a pregnancy, you've probably seen this happen. Pregnant women have really bad posture as they progress along in their pregnancy. And because these muscles are stretched, that can have a lot of negative impacts on their back. So what are some maybe, and maybe this is this what attributes to low back pain in women? Like, what are some back issues you've seen stem from, maybe just pregnancy that you work with women on the regular about, and that maybe could apply to all populations, because a lot of people have back problems.
Yes, so for sure, a lot of kind of unrelenting back pain just in the population at large. That's one of the screening questions that you'll find for pelvic health. Like, if you have been to chiro and physio and massage and they help, but they're maybe not giving you long-term benefits, you might want to consider a pelvic floor exam outside of pregnancy, birth, you know, if you are a human and that is happening to you. Unrelenting back pain can absolutely be an issue with your pelvic floor. Coming back to just that canister analogy, if you don't have, you know, adequate firing, tension, flexibility of the other three components, then it can present as back pain. Mm-hmm. Certainly during pregnancy, we see that increased curve, that lordosis. We get lengthening abdominals. We get more pressure on our pelvic floor and a diaphragm that by the end can't fully move. We can't take a deep breath. So it's not unusual to have low back pain. SI joint pain is very, very common in women. Some women will describe it as right over the side. Sometimes it can feel like more diffuse pain. So one of the things that I like to do with pregnant women is just make sure that this area stays mobile. You know, you're standing a lot in this excessive curve naturally. It's just what happens to your posture as baby comes over the front. But I do a lot of cat cows, if we're familiar with that in yoga, just trying to gently take your spine through that range of motion. So you're getting a little bit of flexion through your spine, a little bit of mobility. Our joints like to move. They need to move in order to be lubricated and bring nutrition to the joints. So if you're stuck in a position because of anatomy, trying to take you out of that a little bit just to mobilize. I have them train their transverse abdominis all the way through pregnancy. So it sounds funny to say, continue to train your core during pregnancy, but continue to train your core during pregnancy. Mm-hmm. Training your core doesn't have to be full planks and sit-ups. It can be, can you pull in those deep belly muscles in lying, in sitting, maybe in a tabletop or 4-point position? Can you develop and keep a little bit of tension in those abdominal muscles, again, to support that low back? It's kind of like a corset. Mm-hmm. Pelvic floor, can we inhale and relax? So we look at the pelvic floor, it comes right up the back here. If you've got a lot of tension, it can start to pull on those ligaments and those muscles, and those SI joints are two-sided. So a lot of my pregnant mamas, again, we're starting to increase that tension kind of around that midway mark. Or maybe they already had higher tension because that's just where they were sitting before pregnancy. We start to see a lot of SI pain in women who have a lot of increased tension in their pelvic floors. So can we release that? Your hip muscles, those rotators get really tight. They're doing a lot, carrying around this extra weight in the pelvis. Can we loosen up some of the external stresses just to give everything a break? Basically, the name of the game is balance. Can we balance you out as much as we can, even though everything is very not in balance?
Yeah.
So, yeah.
Yeah, definitely. Let's just talk about some training techniques and strategies. So do you teach a lot of pelvic tilting at all in your practice? And what are some exercises you do specifically, or that maybe people could do at home to train or to see if their transverse abdominis is firing? Are there anything that people can do either or, and how do you feel about pelvic tilts? I guess are my two questions right now.
Yeah, so I definitely have some go-tos. One of my go-tos is just the core breath. I refuse to call it Kegels because, again, that's just that lift. So the core breath being, can you inhale, let your pelvic floor lower and relax, let your belly come out, and then on your exhale, can you lift that pelvic floor up and in, pick up the blueberry, don't make jam, don't need to squeeze the berry at the top, just gently lift. And with that, the muscles in your lower abdomen underneath your belly button, can you scoop those up and in gently? Again, it doesn't have to be a squeeze, it's just nice and gently, and pair that with your breath. It is going to feel backwards. For at least a week of practicing this, you're gonna think that I misspoke. Inhale, relax, exhale, lift. Trying to get that timing right. That inhale, relax will automatically start to relax your pelvic floor. I usually tell women to start lying down. When you're lying down, you don't have any pelvic organ weight sitting down on the pelvic floor. You don't have your body weight or gravity. But in some cases, it can actually be a little bit harder to connect to that pelvic floor in that position for some women. So if you try it lying down, you're like, I don't feel anything moving. Try it in sitting. When you're sitting, there's feedback on the outside of your perineum. So whatever, I like to sit on like a harder chair, a kitchen chair, a bench. You've got that hard feedback on the outside of your perineum. Now inhale. Can you lower down into whatever you're sitting on and then lift and pick that blueberry up and away from what you're sitting on? So I start there literally with every person to get the pelvic floor and the belly going. If it feels really foreign or like too much mental gymnastics to think about the pelvic floor and the belly together. I start them separately, and we can always join them back up once that motor program is a little bit stronger. So the core breath, and then you're going to play around with positions. Sitting and lying down are great positions to start. But as humans, as moms, we're not in those positions a lot. We're not still. So you need to be able to do it in standing. Can you start to activate this unit when you're lifting your baby, your car seat, and to start to be a little bit more mindful about how you're doing your movements? When we are mindful about it and almost obsessive about it initially, those motor programs then become more automatic. So I always get asked, do I have to do this forever? And the answer is no. Once you start to lift, these things are primed in your brain. Exhale, pelvic floor, belly. They all come on together. It's a loop. So I start there. I love doing cat-cow. I just mentioned that one. I think that's honestly one of my go-tos for like back down. If you have an issue going on, I get you doing cat-cow. Even, I say belly down, but even if you're having any upper back, neck tightness, feeding baby, breastfeeding or bottle feeding, holding baby, it's a fantastic opener for the upper back. What else do I do? Squats. Everybody learns how to do a squat. It's a functional movement. We need to do it every time we get up from the chair. But of course, I come at it from a pelvic floor perspective. So can you engage that inner unit with your exhale as you stand up? So the hardest part of a movement. And then the big question I always get asked with exercise is, what can I do for my core? And any exercise can be a core exercise. You can literally do bicep curls and turn it into a core exercise if you're exhaling inner unit on with the hardest part of the lift. I don't know the fancy CrossFit terms, but when you're throwing weight over your head, engage that inner unit, exhale as you do that up into your snatch or overhead press, and that's a core exercise. Of course, when you start to think about the more standard ones like planks, sit-ups, I'm not really against any exercise per se. Sit-ups get a bad rep. With the right tension, if you're looking for the right things, they can be a perfectly fine exercise. Do I think there's merit in practicing these exercises sometimes? Do you need to sit up like that sometimes? Yeah. If you never practice it, are you more at risk? Arguably, yes. So I mean, I'm not going to have a 6-week postpartum mama probably going right to sit-ups, but if she's 9 months, she's got good tension, she's not having any pain in her pelvic floor, will I say go ahead and try some? Yeah.
Yeah, awesome. And to kind of piggyback off that, so I work with a lot of women in a fitness regard, right? So I'm training women during their pregnancies, strength training, cardiovascular training, and then postpartum, there's this overwhelming demand from women and urge to lose the weight that they've gained. And so my answer to them and my response is, listen, it took you 10 months to grow this human, then you've gone into labor and delivery. I said with the hormone changes and with breastfeeding, you're going to have to be able to consider the fact that it might take another 10 months to potentially a year before you feel somewhat normal again in your new body. So when we talk about pelvic floor health and rehab, how soon after a woman delivers should she come visit you? What are some more extreme cases where you're saying, I mean, I personally believe every woman should go see a pelvic floor physio during pregnancy and after. But when we're talking about women postpartum, how soon should they come see you? And how long, give me the worst case scenario of, 3rd degree tearing or a episiotomy or, cesarean delivery. How long after birth should they be working with a physio to kind of help rebuild their core strength, rebuild their pelvic floor strength and activation safely? What does that timeline on average? I know you can't give me definitive numbers because every woman's so different, but what on average does that look like for you?
Okay, so yes, I absolutely agree. I hope in Canada at some point pelvic floor physio will be standard of care. You have a baby, please, 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 you go have your pelvic floor checked out, assessed for strength. Where is everything at after the marathon that is pregnancy, delivery, and postpartum? So in general, I have women, or I recommend women come to see a pelvic floor physio at 6 weeks. I rest before that. Rest. It's cliche to say, I had in the last year, actually, somebody described that postpartum, that 6 week, as healing a dinner plate sized wound in your abdomen. And when you think about it like that, wow, that's, of course, you need the time to heal. Aside from that, 6 weeks is usually enough time that the perineum, so the outside of the pelvic floor, has healed enough. The internal walls of the vagina have healed enough that if they are comfortable, we can do an internal exam. Certainly, I have women who come to me at 6 weeks that are just not ready to have anything touch their vagina, and that is totally fine. Mm-hmm. There's lots we can start with externally that can affect the pelvic floor. In terms of like timeline of worst case scenario, that's really hard to say. There's so many factors there. You know, where's your hormone picture at? Thinking there seems to be like, there's for sure a shift kind of around 3 months. I don't know what that has to do with baby per se. Certainly around the time that breastfeeding starts to wrap up. So for some women, that's 6 months. Some women, that's 18, maybe even beyond. So there's a hormonal shift there. How well are you sleeping? Do you have any other kids that you're taking care of? What has your workout life looked like in terms of your return, your recovery? These things in general, I'm going to say the average person is probably, even with a cesarean or, let's say 3rd or 4th degree tear, I'm going to say they're probably feeling somewhat normal between 6 months to a year. Mm-hmm. I think every woman should consider their postpartum healing as a year.
Mm-hmm. Yeah.
Definitely. There's just so much that's going on, regardless of the, severity of tearing or your symptoms. It just, the year to not undo, but to rehab from the process that is pregnancy. Like you said, it takes 10 months. It's 10 months. It's 40 weeks, guys.
Yeah.
It takes 10 months.
I know everyone says 9 months of pregnancy. I'm like, it is 10. Do the math. It is 10 months.
Yeah. You're ripping these women off of 4 weeks of hard work. Yeah. It's 10 months. So it takes 10 months to get there. So I don't think it should be hard to wrap our minds around the fact that it's 10 months to a year to fully return to pre-pregnancy. And then of course there's often a little bit of mental work that I try to help women with within my scope. Of course, I refer on when not. But what is so important about getting that pre-pregnancy body back? What does that look like? Of course, there's changes to your tissues. Not all of them are completely reversible. Your abdominals do sometimes stretch a little bit beyond where they were before baby. And so kind of just addressing some of that mental image of who you are and you've grown a human and appreciating what your body has done, I think is really important work as well.
Yeah. I agree with that. And I really hate that phrase, getting my body back. Like, your body has gone through this amazing transition, right? And if it didn't, you wouldn't have this little human that is now yours. And so I really think we need to change our mentality around that as a society. Like, it's not about getting your body back. It's about moving forward and embracing this new body and doing what you need to do for it, which can be super overwhelming in the recent postpartum time because women are dealing with that hormone change. They're home alone with a new infant. Their life has completely changed. Their body's completely changed. And most women still look pregnant right after they've given birth. So you have the belly, but you don't have the baby inside it anymore. And it's a huge psychology. I think an interesting area of study I've always said is to study pregnant and postpartum women. I think there's so much research to be done in that in and of itself. But to your point, yeah, I think we really have to wrap our heads around as society that it takes time. And what you see on the news and celebrities isn't an example of what you should expect to see in your own life, because again, there's Spanx and there's makeup artists and stylists, and so I'm really happy that you kind of have that conversation with your patients as well. And actually, to kind of backpedal a little bit, because we didn't really talk about what people can expect when they come to see you for their first or second appointment. So you have a pelvic floor physio appointment. What's going to happen when I first come to see you?
Yeah, so important for people to know, right? We're gonna have a really long conversation the first day you come. We're gonna talk about it all, of course, within your comfort level, but as we need to know what's going on in your gynecological past. What were your cycles like before baby? Did you have any challenges? In some cases, if you're comfortable telling me about any trauma, physical or sexual, in your past, that is a huge indicator of what could be going on in the pelvic floor. We're going to chat about bowel and bladder habits. What's going on with your personal life intimacy? Is it painful in any way? What was your birth like? We're going to have a long conversation just so we can really get a good picture of what is likely going on in that pelvic floor. Then we're going to do an orthopedic exam. So very much like I was talking about right off the hop, there are so many big movers and important pieces outside of the pelvic floor that have a massive effect on that pelvic floor. We're going to look at your abdominals, your back, your glutes, your hips. If your neck is bothering you, of course, I'm not going to ignore that. We're going to look at all of that and see what's going on. At that point, if you're comfortable, we generally do an internal exam. So that internal exam is really uneventful. I hope most people will attest who have been to pelvic floor physio. I don't use a speculum. It's 1 or 2 fingers into the vagina, and we're seeing what's going on. So the fascinating thing about the pelvic floor is that your muscles can be, well, we're going to assess strength and we're going to assess, can you relax? But that can be different side to side, front to back. And a lot of people don't realize that. So we're going to see where you are on the spectrum. Just because you have a really tight pelvic floor doesn't mean you're not strong. We need to figure out where you lie on that spectrum. Where are the pelvic floor or pelvic organs sitting in terms of position? Have they lowered at all after a vaginal delivery or just during pregnancy? Do you have any points in the pelvic floor that are sore that we think could be leading to some of your painful intercourse or your pelvic pain in any way? That's the information we're going to gain from an internal exam. Lots that can be done if you're not ready for that yet, and that's totally fine as well. I think it's really important to know that pelvic physio doesn't just center on the internal exam. There's a lot of information that we're gaining from that conversation we're having and externally that's giving us a pretty good idea of what's going on internally. Of course, you're going to be sent away with a lot of education on things that you're going to work on and signs and symptoms that let us know that your pelvic floor is doing well or not. So it's important to know that the internal exam is important. I think it's super beneficial, but if you are not comfortable for whatever reason, and there are many valid reasons, it's not that pelvic physio isn't for you.
Yeah. And I mean, there is something to be said about the internal versus non-internal exams. However, in my personal opinion, based on what I know about anatomy and muscle contractions, I think you do really need that internal exam, right? Or like, how effective are you going to be at understanding which muscles are tight without having, someone assess that for you? Because I know even when I go see pelvic floor physiotherapist every year, just as a routine check-in, right? Because I do CrossFit, I like to lift heavy, and that can also predispose my pelvic floor to stress and trauma, right? So all the athletes out there, like, this directly can affect you as well. So I found that without, if I didn't have that internal exam, I wouldn't have felt some of those pressure points otherwise. Another thing I've heard from clients that I've worked with, they're almost disappointed that the first little bit of homework that they got was breath work. Like, they just give me breath work to do. So why don't you talk about, I know you've already touched on it throughout, but why is the breath important when we talk about contraction of our transverse abdominis pelvic floor? And then also, why is it important when we think about exercise lifting? Because whether we want to believe it or not, when we're lifting a car seat or carrying that around, when we're pushing a stroller, that is exercise. And that exercise is going to impact your breathing and impact potentially your pelvic floor. So would you elaborate a little bit more on why breath work is so important and how it can help impact your pelvic floor both negatively and positively?
Yes, awesome. I love that you said that lifting car seat and babies is exercise. Being a mom is 24-hour workout. There's always stuff. There's times I'm carrying around my 3-year-old, 19-month-old, and I'm carrying 60 pounds up and down stairs. It's hard work, guys.
Mm-hmm.
But absolutely, the first session, we always talk about breath. And the short answer is most of us aren't breathing right. That sounds ridiculous. You're breathing. Of course you are. You're living. But are you breathing correctly? Are you breathing correctly during your lifts? I would argue that most of us, before coming to a pelvic floor physio, myself included, even sometimes as a pelvic floor physio, our default pattern to lift something is to hold your breath. Not terrible, from time to time. And certainly if you are an Olympic lifter and you're doing these 1-rep maxes, you probably need to hold your breath to get that stability. But it's not an effective strategy all the time, day in, day out, every time you lift. Over time, that breath pattern of holding your breath or taking shallow breaths even can put a lot of stress down on your pelvic floor. Things like you're more at risk for things like a diastasis, creating a diastasis, or worsening one that's there, pelvic organ prolapse, urinary incontinence. And what I tend to see is we see these things come up a lot in menopause again. So women have this second hormonal shift that when we're having babies, we sometimes forget. I feel like I'm always planning for women to be postpartum. And then when they're postpartum, I'm planning for them to be menopausal. So we want to have good patterns that are going to prevent any of these issues from coming up later in life. The easiest way to do that is to focus on your breathing and your breath. And like I said, when I tell people inhale, relax, exhale, lift, I'm going to say 95% of people say that seems backwards. And that just kind of solidifies the whole idea that most of us aren't breathing correctly. Or when you are lifting weights, you're not exactly engaging that core to its full potential. You're either holding your breath or you're inhaling, trying to get your pelvic floor. If you have some sort of awareness that you should be, engaging your abdominals and your pelvic floor, you're inhaling. So we do start there. One thing that I really try hard to do as a pelvic physio is this is where we're going to start, but this is how it's going to link to what you want to do and what your goals are, because I get it. I get it if you are a CrossFitter or a runner and you come to me and I'm just like, lie down on this bed and just inhale, relax, exhale, lift. I get how that doesn't seem like I'm even listening to what you want to do.
Yeah.
So I try really hard to link it to this is where we're going to start. This is how we're quickly going to move closer to what you need to be able to do. This is the foundation of the house, and it's all built on this. I often usually will tell women, and I can gauge people pretty well if these are the steps I think we should follow, but if you're going to leave my clinic today and go for a 5-kilometer run, it's totally fine. These are the things you need to know. And this is how you should treat your pelvic floor, your core after that. If you weren't quite ready, what are you looking for?
Yeah. And the biggest problem I see, and working with women for 10 years, with my postpartum women, I have a very structured, progressive training program that I do with my postpartum women, my stroller moms. They don't know it, but it's progressive. And as someone who's done it, they always say it makes sense now after hearing Dayna or pelvic floor talk why we start off so basic. But I think with anyone, athletes, men, women, everyone likes to start with too much too soon, and that just inevitably leads to injuries. Like I see that all the time as a strength and conditioning coach. I've seen it with athletes. I see it with my mom. So how would you maybe approach the conversation around return to exercise, and what do you coach, and how do you teach your patients about that?
Yeah, I love this question. I love to exercise. I love to work out. I think that there is such a huge mental component to it postpartum as well, social, feeling a little bit like yourself, outside of just being a mom now. I think there's such an important piece to it beyond what's going on with just your pelvic floor. So that's why I said I like to really link what I want to start with and what my kind of goals are. You have to marry the two. You have to listen to what your client and woman is telling you in front of you, so that you don't seem like you're on two different pages. I find a lot of women, they get to that 6-week mark and they're kind of, maybe they expect it, or they're given the impression that this magic wand has waved and everything is healed. Go forth, listen to your body, just return to what you did. That may work for some women. It might, they might go ahead and not have anything, but are you really listening? Did anybody tell you what to listen for? So I have my 5 things. And yeah, you've heard me say this. I will continue to say this for years to come. My 5 things that you're listening for postpartum, and it starts from day 1. So, you're always listening for these things. Early days, if your postpartum bleeding is still around, if it gets worse, even with a walk. So whatever you're doing that day, if you go for a walk, we'll use that as an example, and it gets heavier, or it went away and it came back, that's a sign that you've gone a little bit beyond what your body was ready for in this healing time. If you're leaking more, or you weren't leaking and you start leaking, that's something you want to listen to. If you have any pain anywhere really, but particularly in your abdomen or in your pelvic floor, if you have any feelings of heaviness or bulging down in the pelvic floor, or feeling like there's something sitting in there, or if you're getting excessive doming, coming back to that diastasis, you're starting some new exercises and you start to see that doming. Those are the 5 things you're listening for. They're not anything necessarily to freak out about. If you're not leaking and you go for a run and suddenly you start leaking a little bit, it's information. It's something you should absolutely pay attention to. Recognize that maybe you went a bit beyond what your body was capable of at that time, and try to change something. What I really caution against, and this comes, my good friend Rhonda Chamberlain, she's a physio and is also a postpartum coach now. She talks a lot about the athlete brain. I think, Steph, you've talked a lot about the athlete brain too, and this push through it, it'll be fine, or it's nothing. Mm-hmm. These things start as whispers and generally will get louder and louder. Things like leaking postpartum, pain postpartum, that doming, those aren't things that are generally just gonna go away one day. They're likely to stick around. And again, when we're thinking about that timeline, maybe they do go away for a little bit, but they're likely to start showing up again when you're menopausal and we have that second hormonal shift. So there are things to pay attention to, cues for you to change something, maybe see a pelvic floor physio if you haven't seen them, and go from there.
Yeah, and I really like that you brought up menopausal, because I'm going to use my mom as an example, and she lets me do this all the time. And I also have women at the gym that I have these conversations with, but my mom is very fit, very active. You could see her 6-pack. She was very physically fit, and she went and picked up a box one day and she ended up having a prolapse. And I'm always curious as to how many women, especially because I work, the gym that I work in, we're a huge community gym, but how many women do we potentially get every year that come in, we want to exercise again, they want to re-engage in physical activity for their health for whatever reason, and then they potentially have a prolapse because they were never ever taught or trained how to breathe, how to connect with their pelvic floor, or maybe they did a long time ago, and now, like to your point, the hormonal shift has caused this change again. So how often should someone go see a pelvic floor physio then, postpartum or throughout their life cycle? Would you like to see someone every year? Is every 2 years okay? Like, what is that life check-in like? Because we go see our doctors, or we're supposed to see our doctors for, our routine physicals. I go see a pelvic floor physio every year because I see the importance in it as a female, even though I'm never, I had my egg donation, so that was I guess I have kind of been housing a lot of eggs at one point, but overall, what are your recommendations for people for seeing pelvic floor physios, both men and women?
Yeah, if I had my way, I think it's important it's great to every year, once a year. There's lots that can happen in a year. I love that you said, I'm really active, I do a lot of lifting, I recognize that this can change my pelvic floor. Absolutely. That's my kind of gold standard. For sure, 6 weeks postpartum, during pregnancy. Sometimes it's just one check, right? I have women all the time, they come in and I'm like, you know what, things are pretty good. Here's some tips. Go forth. If you have any issues, come back. So certainly those times, once a year, ideally, at least once during pregnancy, 6-week follow-up. And then if any sort of hormonal shift, if you feel that shifts, you start to become perimenopause. So maybe you haven't seen your pelvic floor physio for years. You start to get into that perimenopause where your periods start to get a little bit different. They start showing up, you get all these other symptoms. Maybe you want to check in then. For sure, if you are deemed menopausal, you've had that kind of hormonal shift and you're just curious where you're sitting kind of on the spectrum now. I think those are all good indicators or time stamps where a pelvic floor physio could help you and give you some tips and tricks for that time. But then outside of that, of course, anytime anything comes up. So it's no different than when you pull your hamstring and you're like, shoot, now I got to go see my RMT and my physio. It's the same thing. You ran a marathon, you did this awesome feat. Maybe you want to check in with your pelvic floor physio, see what's happened after your training, or, if something's come up, you did all this running and now you're having some leaking or pain, check in then. It's like anything, the sooner you're kind of on top of it, the easier it is to treat.
Yeah, no, definitely. Great points. I'm always like, I always teach people, my clients, try to be proactive with your health, right? Don't be reactive. Don't wait for something to happen before you address it. Anticipate that in your life, these are things that can happen. And now from a pelvic health perspective, we know as women, these are things that we are going to inevitably deal with at some point. So let's be proactive in our health and let's be advocates for our health in that. To shift gears, because I know we're wrapping up on time, I just wanted to get your perspective on women's health and everything that's been going on during this pandemic. Like COVID-19 has really shaken a lot of people in different ways. How has it affected you in your practice? And what are some maybe problems we might be dealing with in the near future because of the pandemic in regards to women's health care as you see it as a practitioner?
Yeah, the world turned upside down. So I switched my practice virtually. Within a week or two, I've been seeing women completely virtually. So what that means in terms of, you're asking, what does a pelvic appointment look like pre-COVID? That was that long conversation, the orthopedic exam, the internal exam. We're not doing any internal exams, obviously virtually. So we are having lots of conversations and we're doing lots of orthopedic exams. We're starting with exercises, really talking a lot about what are we looking for to let us know if this is going well or not, and we need to tweak something. And I've really been so happy that with the results. So back to my earlier point where I believe in the internal exam. I absolutely believe in the importance of it or the merit in it. However, this time period has shown that there really is a lot to be gained by just educating a woman about her body and how it works and how she can, take onus and do some things for herself. With that being said, I think we're going to see, and I have been seeing a lot of conditions kind of rearing their heads. So things like symptoms of pelvic organ prolapse or urinary incontinence or pain that were seemingly in check and doing well have kind of started to rear their heads. The pelvic floor tends to be I always called the neck muscles the stress center. I now believe it is also the pelvic floor. And so during this stressful time of world stress, but also more caregiving at home, more lifting likely of your babies. And this is even outside of our expecting mamas. I'll touch on them in a sec. There's a lot more tension and tone that I'm treating in women virtually, obviously, talking a lot about how do we let go of tension, how do we use our breath to let it go. So I'm seeing a lot of that. I suspect that will continue. Our pregnant and recent postpartum mamas are rock stars. They are not only entering this unsure time of their lives, it's an unsure time of the world. And they went into hospital and not knowing what their deliveries were going to look like and if their partners are going to be able to be there the whole time. And my heart has been with them. I think that has been really challenging for a lot of women and maybe not even talked about enough. So those women kind of postpartum, I've been checking in on them, and in general are just really grateful to have someone reach out and say, hey, how are you doing?
Yeah.
How are you? Right. So same kinds of things, a lot of increased tension, increased symptoms around it. Yeah, it's a tough time.
Yeah, it is. And again, stress being a catalyst. And I agree with that, even in the labor and delivery room, right? If you're, it's just like if you're cold, you know, we always say, don't work out if your muscles are cold. Why? Because they're tense, they're tight. There's more likely that they're going to tear. You're going to have a strain or a sprain, right? We want to move through that. So I think that that's a really great point. You know, the more stressful you are, the more that might manifest in your pelvic floor, and why maybe we should be more in tune with our stressors. And unfortunately, COVID-19 was a stressor that we have no control over, as a lot of stressors are. But getting maybe back to looking after your health, being proactive with maybe identifying stressors in your life and potentially seeking advice or help in order to manage those, I think is an important point. So we only have about 5 more minutes, so I think we're going to wrap it up. But before we do, for those people in Canada who are like, I didn't know any of this, I want to go see a pelvic floor physio, how do I find a pelvic floor physio in my area?
Yeah, so there are lots of resources. I mean, good old Google is pretty good. I think most of the major municipalities have great pelvic physios. I work at Rebirth Wellness Center in London. I know there are global directories. So I think it's called the Global Pelvic Health Alliance. They're a great one. They'll have therapists in Canada as well as, like I said, globally. In London, I'm at Rebirth Wellness Center. If you have any specific questions about different municipalities, you can always shoot me a DM and I can link you to anybody who I know in that town or find someone who does. I know a lot of physios who know pelvic physios as well. So even if I don't know them personally, but yeah, just they're out there. So
yeah. And that brings me to my last and final point. If people want to connect with you, I'm going to share your information, but what are your handles? How can people get in touch, either for a virtual, or I've heard now we're seeing people in person again. So how can people connect with you, Dayna? Give us your handles, give us your information so we can keep spreading this information to people. Go.
Yeah, awesome. I am on Instagram at @pickuptheblueberry. And yes, in Ontario, we're able to start seeing clients in clinic. So that's a big deal. So I'm at the Rebirth Hyde Park location in London, Ontario. So you can book with me online, give us a call, or DM me on Instagram. And of course, we'll be doing all of the physical distancing, and appointments will be a little bit more spread out than usual, but we will be there for you. So if you need me, that's where I am.
Yeah, and I encourage everyone who's watching this, if you have not checked out Dayna's Instagram page, Pick Up the Blueberry, I strongly recommend you do. I love the tips that you post. I love everything you say on there, because I just think, even though I haven't experienced childbearing and childbirth, I think it just resonates with so many of the women that I've worked with over the years. And I think it's really good quality education that most people don't know about, and you're just so good at disseminating that information. So I just want to thank you, first of all. And for everyone who hasn't checked out her page, go follow Dayna at Pick Up the Blueberry, because she's amazing. So on that note, Dayna, I just wanted to say thank you so much for joining me live again, because you know I love chatting with you and seeing you. Hopefully we'll get to actually see each other in person next time we do this, have like a live Q&A together. Wouldn't that be something, right? But thank you so much for your time. And if anyone has a question, you have about 90 seconds to post it. Otherwise, we're going to wrap up. And I'm going to say that you can follow myself. I'm going to post this video on my HGTV on Stronger Fitness, so you can check it out there as well. Like I said, Dayna has a ton of resources available if you want any more information. It doesn't look like anyone's got any questions on either of our platforms. So with that, Dayna, again, I just want to say thank you so much. It was great chatting with you. And for everyone watching, thank you for tuning in. And we hope that you'll check in for the next live. We've got lots of practitioners lined up over the next few weeks. So thanks for joining us, and have an awesome day, everyone.
Thanks for having me. Bye.
Bye. All right. So that wasn't